Hello everyone. I want to take a couple moments to talk to you about the listening class. I'm in the Bukhansan forest right now, just outside Seoul, Korea. And just behind me you can see the Obong Peaks, which means 5 peaks in Korean. It's a beautiful hike just outside Seoul. So in the listening class, we're going to take a significant amount of time in the class to explore the general listening, the local listening, extended listening. We'll be doing a listening through the spine. We'll be listening through the cranium. So for example, when I ask most of my students what is the one thing that they struggle the most with, they almost unanimously tell me that it is the general listening. So we'll be spending the first day really exploring the obstacles that might be in your way that are preventing you from feeling confident with the general listening. So we'll be doing a general listening in the standing position, a general listening through the arms up into the thorax, a general listening through the legs into the pelvis, a general listening for the person that comes to you that is in the supine position, for example. Maybe they're bedridden or in a wheelchair. So you need a means that'll help you to get a general listening in any situation. And so we'll be helping you modify the general listening to fit whatever clinical practice you have. Then we'll be spending some time doing local listening. And in the local listening, for example, we're finding the exact what tissue, the specific tissue in the body that is most restricted in that general area that you were led to with the general listening. But the problem with that is that when you do a general listening, you get a listening that goes to the right, for example, anterior below the diaphragm. There are lots of possibilities in this area. So we're going to help you with expanding your qualities of perception. For example, if you get a general listen that goes to the right, anterior below the diaphragm, and you get a local listen that goes to this specific area, it could be, for example, the duodenum. It could be the kidney. It could be the ascending colon. It could be the space in between the duodenum and the ascending colon. Or it might possibly be even the liver or the common bile duct. So all of those have a different quality of perception. So we'll spend a significant amount of time really exploring the different qualities of perception so that you will have more confidence with your local listening. And then we'll be bringing in inhibition throughout the entire course. And then we'll do listening from the spine, for example. We'll be listening to feel if it is in the spinal segment. Is it in a facet joint? Is it in a disc? Is it possibly even taking you about 30% anterior to the spine? So is the spine really just a compensation to something that's actually going on in the viscera? So we'll be exploring that. And then we'll also be doing extended listening. The question when we do extended listening is that local listening spot by itself, or is there some other structure, tissue, organ that it's struggling with? And so that's what we'll be learning in the extended listening. And then at the end of the class, we're going to be bringing it all together by listening through the cranium. So we'll have an exercise where we do a general listening at the cranium into the structure, do a local listening to the specific spot, an extended listening from there, and turn that into a treatment. In the bone part of the class, where we're working on listening to the bone, you'll also have an opportunity to listen to what osteoporosis feels like, if we have any of those cases in the class, versus osteopenia. And then also we'll talk a little bit about how do you treat a restriction in the bone. So I'm looking forward to seeing you at the listening class. I think you'll really enjoy it. I think it will really help to enhance your skills as a manual therapist.